Hello, this is Emily Dunlap from Aquatic Therapy Pro, and believe it or not, I've spent quite a bit of time looking at researching waterproof dressing applications for the aquatic therapy environment. And why have I done that? Good question. Not quite sure, but what I am sure about is that I would like to share some of this information with you today. Okay, there are a few things that are important to consider when using waterproof dressings in the aquatic setting. First of all, you need to recognize that there's no way to guarantee 100% of the time that that dressing will stay intact through the entire treatment session. That, let's face it, things happen, and you might have an instance where the dressing becomes undone and water will be in contact with the wound. So if that is of great concern to you, you're going to have to make a decision about whether or not to bring someone in the water or not. And of course, if you're not quite certain, always seek the advice from a healthcare professional before you decide to bring someone in the pool, even with a waterproof dressing. Now, that being said, the research that I did has shown me that if you apply the dressing correctly and have some common sense parameters, you can be expected to have somewhere between 90 all the way up to 100% success rate of that dressing staying intact. And let's talk about some of the factors that will help us to get the best success rate possible. First of all, you have to think of the person's skin type that you'll be applying these dressings. If someone has oily skin, they're going to have a harder time making that, or it will be harder for that dressing to be, stay adhesed through the whole session. So one thing you can do is thoroughly clean the skin before applying the dressing. And this is true even with people with normal to dry skin, but if they apply a lotion before they get in the water, it's very important to get that off the skin before you put the dressing on. The next thing to consider is if there is hair present. If there's a significant amount, you want to trim that away. And I was surprised to find out when I was looking at these products that the manufacturers recommend that you use a hair trimmer like a man might use to trim a beard versus a razor, because a razor would have a tendency to cause microabrasions that can be irritating while that dressing is on or after you take it off. So keep that in mind. The next thing to consider is the length of time in the pool. So the first pilot study I did on this topic, I had people in the pool with the dressings for 2 hours. And honestly, that was probably a lot longer than I would have the majority or really almost all of my patients in the water. I tend to keep my time to about an hour, maybe an hour and a half at most. So follow-up study I did had a shorter length of time. In fact, I looked at people when they first went in the pool and I checked every 15 minutes up to an hour. And what I found from that study is that I'm recommending you limit the treatment to 30 to 45 minutes and check the site often. Now, you can use your judgment to keep them in longer or shorter, but this is what my research has shown, that if you're in there for 30 to 45 minutes, you have a pretty reasonable waterproof success rate. Now, the location of the wound or the dressing is also important. In general, moving joints are more challenging to get a good adhesion while you're in the water, and it's very important to position the joint correctly, and I'll demonstrate this in the video to come. But in general, you want to avoid any stretch of the dressing film material while it's on the body and the person is moving in the water, because this stretch of the material will actually reduce the adhesion properties and might make that dressing fall off. The other thing to consider is the type and intensity of the exercise in the pool. First off, if you're doing intense exercise that has a tendency to make someone sweat, that sweat that builds up underneath the dressing will affect the ability for it to maintain its adhesive properties. But in addition, any excessive movement that we talked about earlier will have an impact. And I'll give you an example, a practical example on this topic. So if you had someone who had a wound on their knee and you put a dressing on it, even if you put it on correctly just the way I'm going to show you, you still probably want to be cautious of doing any excessive knee flexion motion that might have a tendency to strain the product that's on the knee. So instead of doing things like deep water jogging or end range aggressive knee stretching while someone has a waterproof dressing on, you might want to stick with activities such as water walking or leg swings that doesn't involve as much end range knee flexion, so that you'll have a better chance of keeping that waterproof dressing intact. Before I start the video, I just want to mention that it's important to select the size waterproof dressing that you know will give you a 1-inch border surrounding the wound and or dry dressing if you have a dry dressing over the wound. So keeping that in mind, I'm going to start the video. This is my friend and we're going to pretend she has a wound on the front of her knee right there. So if there isn't a dry dressing on the wound, I recommend you go ahead and put a clean dressing over it just to prevent any irritation of the wound when you remove the waterproof dressing. Now, here's the hair trimmer. She doesn't need it, but if you had a man, you might need to use a hair trimmer to prepare the leg for the next step, which is to clean the skin. So in the video, I'm using an alcohol wipe, but you might use a different product to clean the skin, just depending on what you're trying to clean. If you're removing oils or lotion, you might use one thing. If you actually have a lot of dirt that you need to disinfect, you might use a different product. In any case, you want to make sure you clean a site that is large enough to get the entire waterproof dressing, and probably even aim for a little larger to make sure that the edges of the waterproof dressing will be on clean skin. Next, you're going to apply a skin preparation product. So if you're not familiar with these types of products, they're designed to do two things. They basically apply a what I guess I'm going to call a false skin layer over the clean skin, and it does two things. First off, it helps, it's almost a tacky surface, and it helps the waterproof film adhere better to the skin. But also important, it reduces skin irritation when you remove the dressing. So I'm not going to recommend one product over the other. I've used at least 3 and have found them all to be pretty helpful. Next, I want to just point out the really important step of having my friend bend her knee into as much flexion as possible, so that when I apply this dressing, it will be with the knee fully flexed, and I'll be pretty confident when she's moving around in the water, she won't be stretching the film on her knee because her knee's already in full flexion right here. So what I did was follow the directions on the product that you're using. I've used different waterproof dressing products, and they've both, or at least the 2 that I've used, have both worked equally as well. Usually these products involve some type of paper lining that you'll remove, and then you'll place the dressing on the knee without a stretch. So if you watched when I put this dressing on, I just placed it directly on the knee and I didn't stretch it in any way. Now what I'm doing is just smoothing the film from the center near the wound towards the edges of the waterproof dressing, and what this does is get rid of air pockets that might occur, but also the smoothing I'm going to recommend you do for maybe 30 seconds or so, because the heat from that smoothing motion helps to set the film onto the knee. It helps with the adhesion. So go ahead and smooth that out for, let's say, 30 seconds, and then you can use two fingers to give us an estimate for an inch, checking for a border all around the wound. Now, if I extend her knee, you'll see some wrinkles in the film, but those wrinkles aren't a problem. That knee dressing is good to go in the water. I'm going to go over what I find to be common application errors for waterproof dressings in the aquatic setting. First off, that I want to mention, when I did a survey of over 200 aquatic professionals about the use of waterproof dressings, I found that well over half of them stated that they didn't do any special skin preparation prior to using these products. So I just want to point out that it's really important to prepare that skin, to clean it, and use some type of skin prep prior to putting the waterproof dressing on. The next common error I found, especially for those who are new with using these films, is that they will stretch the dressing film before they place it on the skin. And I mentioned before that the problem with this is that if you stretch it before you put it on the skin, it's going to be more irritating for the skin, but also it's going to have a reduction in its ability to adhere properly. Another common application error I find is that people either forget to position joints or they just incorrectly position the joints so that the dressing might get a stretch when they exercise in the water. Then the last thing I'm going to mention is that sometimes people forget to check for a 1-inch border all the way around. Now, sometimes people select the correct size of the waterproof dressing, but they might accidentally asymmetrically apply it and one side, let's say, doesn't have that 1-inch border. Now, if that was the case, a very easy fix for this would be to just apply another dressing over the existing dressing to make sure you get that 1-inch border, and that way you don't need to remove and reapply, and that will solve that problem. Okay, so we will now pretend that our person has been in the pool for their 30 or 45 minutes, maybe longer if it looks like that dressing is remaining intact, and it's time to remove the dressing. There are a few quick tips that I want to talk about when you're removing. So first, what you want to do is peel the edges of the dressing so that you have a purchase on the waterproof film, and you want to pull in a way that's kind of down and out, horizontal to the skin. What you don't want to do is pull perpendicular away from the skin, because that can be irritating. We want to really apply a stretch on this film, which is exactly what we were trying to avoid when we were applying it, but we want to stretch the film when we want to take this dressing off. You can use a technique like I'm showing with your hands opposite, or you can just do one edge at a time, but you can see that dressing comes right off once you apply that stretch. I hope the video has been helpful. I've come up with a set of instructions that you can laminate and keep poolside. Some have pictures, this one does not. I realize it might be hard to see in the PowerPoint, so feel free to visit Aquatic Therapy Pro and shoot me an email, and I'd be happy to send you this document so that you can print it out and use it at your facility. I hope this has been helpful. Have a great day.